So in the next maybe 30 to 40 minutes, I'll be introducing the Mental Health Care Act. It will be basics for many people who have read about Mental Health Care Act, but I'll be giving the introduction and later I'll be taking the questions. So these are my credentials. Of course, I also would like to emphasize that I did my PhD in law from National Law School, Bangalore. My thesis was on mental health legislation, basically how it evolved maybe around 200 years back, how it started in UK and how it was brought to India. What are the ways it got evolved from Indian Lunacy Act to Mental Health Act of 1987 and then current legislation. So that was my thesis, and also critiqued about the current legislation. I got my PhD in 2015, but later 2017 the legislation was passed. So my discussion on Mental Health Care Act will be more from the perspective taking. I have reviewed most of the legislation across the world regarding the Mental Health Care Act, and in the beginning only I will tell you this is one of the best legislation in the world. Idealistically, that means it's, if you compare any legislation with regard to Mental Health Care Act or mental health care, one of the best legislation in the world. The issue here is it is very idealistic, aspirational, but whether it can be implemented is the question. So, but anyhow, let's look into the history. The history, if you look at Indian Lunacy Act, at that time in 1912, there were no treatment available. So invariably, it was custodial care. And till 19th century, the mental hospitals, or we call it as asylums, were under the custody of the prison department. Till 1905, that is in the early part of the 19th century, it was under prison department. And if you look at the old mental hospitals, they are next to the prison, or next to the prison means custodial care, only to lock them up, protect the society from mental ill. That was the thinking process in 1912. But however, in 1950 we started having ECT, chloropromazine, and then deinstitutionalization, community care came into picture, and then we started envisaged about Mental Health Act of 1987. It was more focusing on treating the person with mental illness at any cost. So we wanted to treat at any cost. So that was the reason 1987. But invariably 2017 came in. The main reason being is we signed the UNCRPD, that United Convention on Right to Persons with Disability. We have signed that. So we need to align our national legislation. Hence, Mental Health Care Act and Disability Act got repealed, and then we drafted a new legislation. So this UNCRPD, we signed it, and once we signed it, Mental Health Act of 1987 was not adequate, and even the PWD Act of 1995 was not adequately protecting the rights, and hence we had to come up with a new legislation. So the new legislation is Mental Health Act of 2017, and NIMHANS was involved in drafting rules, not the legislation. The main legislation was drafted by the ILS Pune, that is Indian Law Society of Pune. Dr. Samitra Patare, Dr. Jay Sagde played a crucial role, and they did it pro bono, that is free of cost. They drafted this legislation, Mental Health Care Act of 2017. So it was passed in the parliament on 7th April 2017. And by that time, my PhD results came in, and then the rules was given to draft by the NIMHANS, and I played a crucial role in drafting the rules. So 29th May 2018, the rules were notified along with the legislation came into effect. So 29th May 2018, the legislation came into picture. So if you look at the timeline, these are the rules. Mental health care rules 2018 was notified on 29th May. Mental health care Central Mental Authority and Mental Health Review Board rules were notified, and State Mental Health Authority rules were notified in 2018. Further, 16th August 2019, guidance document on capacity assessment was also notified, that is under section 81. And finally, the regulations were also notified. And also the essential list of medicine were also notified. So finally, the mental health regulation came in 2020. That is 18th December 2020. Central mental health regulations have been notified. So these are currently the rules and regulations. That is legislation 1, 3 rules and 1 regulations have been notified till now, along with the guidance document of mental capacity has been notified till date. So the Mental Health Care Act has 16 chapters and 126 clauses. If you look at the preamble is why this legislation was written. So it has two important, what we call it as principle or the reason. One is, the first principle is we need to provide mental health care and services. That is access to mental health care. This legislation says we have to provide care. First time in the history of India, the government said we will take responsibility of providing access to care. So that is the first preamble. Preamble is the reason to write this legislation. Act to provide mental health care and services for persons with mental illness. First preamble. Second, it says is to protect and promote the fulfill the rights of the persons with mental illness during the delivery of services. That means not only we will try to provide access to mental health care, but also to protect the rights of the persons with mental illness during the services. So these are the two important objectives they had kept in the mind. Why this preamble becomes very important is, if there is any doubt in the mind of the court or in the mental health review board or in the high court or supreme court, then they will go back to this preamble. If there is no law written, then they will look into this preamble. If there is no section, clause, if there is a gray area, they will look into these two important preamble points. That means government is trying to provide services or access to services. That is the first one. Second one is, during the services, we need to uphold the rights of the person with mental illness. With these two important objectives, they went ahead. These are the 16 chapters with the corresponding sections. So if you look into the first chapter is preliminary and definition. Preliminary is basically preamble and why it is come into picture, when it will come into picture, and various definitions. So definitions, there are a couple of what we call it as uh, conflicts or controversies, but otherwise it's fairly well written definitions. And the second part, that is chapter 2 to 5, is the heart and soul of this whole legislation. That is, rights of the persons with mental illness comes into picture. That is from chapter 2 to chapter 5, that is from section 3 to 28. This is the heart and soul of this legislation. That is beating, this is the heart, if you ask me. The next are implementing authorities, that is state mental authority, central mental authority, mental health review board, and mental health establishment. Those come into picture. The last part is admission, discharge. What are the responsibility of others? So those are the things. So if you look at any legislation, this is how it will be written. First will be why it is written, that is preliminary and definitions of those. Second part, substantial law will be written. Second part, that is the rights of the person with mental illness here. Next one is statutory bodies, the bodies which are going to implement the law. And finally, the admission, discharge, those kind of things. Like even if you look at the RPWD Act, also has been made it in this fashion. Now let's look into the first two chapters. Chapter 1 is, as I mentioned, preliminary, short title, commencement, definitions. And section 3 and 4 talks about determination of mental illness, and 4 is capacity to mental health care and treatment decision. In this, determination of mental illness means it is basically how you are going to diagnose a person with mental illness. It is basically based upon international standard, either ICD-11 or DSM-5. At the same time, in the definition, there is a mental health establishment has been definition has been given. Basically, what is mental health establishment is the patient anywhere except from his residing place. If he is staying there for overnight, that will be considered as mental health establishment. Under the sun, in the jurisdiction of India, apart from his house and daycare centers, if he is going to stay in a place for a purpose of treatment, invariably they will be called as mental health establishment. Registration, those things have been mentioned. Now moving to the important aspects is capacity assessment, advanced directives, nominated representatives, and rights of persons with mental illness. These are the crux. What are the rights have been given? So rights of persons with mental illness, I'll be discussing. This is the heart and soul what I mentioned. So this is the legislation which articulated the rights of a patient or a person with mental illness. So if you look at the determination of mental illness and capacity, you can't just call anybody a mental ill. There is a method to do it. And also there is a capacity assessment is there. Many people from Kerala have worked in UK. There, the Capacity Act is different, Mental Health Care Act is different. So Capacity Act, I think in 2005 it came, in 2007 I believe Mental Health Act came in. So they are different there. But in India, that has been amalgamated into a single legislation. Hence, we have capacity assessment and mental illness part. The other important which has come is advanced directives, that is a living will, nominated representatives, and right to persons with mental illness. This mental capacity, what is this? See, the whole legislation revolves around one important aspect, liberty. That is, liberty means basically you can, like if you, how that liberty came into picture. If you look into the Constitution of India, right to life and liberty. So right to life and liberty means every person, including the alien who comes into India, has a right to life. You can't kill anybody, even if he is from Pakistan or somebody else, or even an alien comes into India, maybe from other planet, you cannot kill. That is, right to life is there, and liberty. But invariably, what happens is, if you want to curtail this right to life and liberty, there should be a law to curtail both. For example, if a terrorist attacks India and then you want to have a judicial punishment or hanging, he has to go through the procedural law, that is CRPC earlier, now it is Bharatiya Nyaya Samhita, IPC, all those will come into picture. That means there is a procedural law should be there. Similarly, in mental health care, you cannot admit anybody and treat them, because the constitution will say you need to have a procedural law to admit somebody, to curtail their liberty, or to give treatment against their wish and will. So Mental Health Care Act of 2017 is the legislation, enabling legislation to curtail the rights of the person. So unfortunately, many psychiatrists believe why this legislation is imposed on them. Let me tell you, there is no subject in medicine where a treat can be imposed against the wish and will of a person, unless it is an emergency. Emergency means right to life comes into picture. That means if a person is not in a position to decide, is in a coma, right to life will prevail and the doctor has to save him irrespective of the consent. No, sir, he is alive, he is able to speak. You cannot treat him, admit him against the wish and will. That means he has a right to refuse a treatment. That's what has been told in the Supreme Court judgment, and it has upheld in the important decision, Common Cause versus of Union of India. In one of the landmark judgment, they have said you cannot treat anybody against wish and will. But if there is a procedural law like Mental Health Care Act, which says if you want to treat somebody against their wish and will, there should be a law. That law is Mental Health Care Act. But again, you cannot, just because somebody has mental illness, you want to treat. No, it is not allowed. They need to lose capacity. That means they are not in a position to give consent. So that's the section 4, mental capacity to consent for admission treatment. Again, the capacity assessment in Mental Health Care Act revolves around only regarding treatment and admission. It doesn't discuss about the property. It does not discuss about the immovable property, movable property. No, it is concerned only with Mental Health Care Act. Mental health care, very clear. That is the reason I told you preamble. What does the preamble says? Providing care, mental health care, and protecting the rights of the person when providing the care. So it does not talk about the property. So now coming back to the section 4, what does this capacity means? If you want to admit somebody into a mental hospital who is mentally ill, you need to take consent. Should I take from the patient or from the family members? So invariably it should be patient. No, sir, the patient is not in a position to give consent. Then he should satisfy these 3 important criteria to say he does not fulfill the capacity. What is that capacity? Understanding the information. Whatever you give information, he is able to comprehend or not. That is understanding the information. Second one is appreciating the information given, and he is able to weigh the risk. Yes, if I take treatment, what are the positive, negative? If I refuse treatment, what are the positive and negative? If you are, he is able to appreciate. And finally, communicate the decision. These are the 3 important crux under the Mental Health Care Act of 2017, which talks about mental capacity. These are the 3. But however, if you look at the UK Act, it has one more: retaining the information, understanding the information, appreciating the information, weighing the risk, and retaining the information, communication. But here they have given only 3 important: understanding the information, appreciate, and communication. But in this section 4, there is some typological error. It says or, but it has to be read as and. That means he should understand the information, and appreciate and communicate the decision. He needs to fulfill all three, then only he has capacity. If he doesn't have one of them, he doesn't have capacity. You will take the consent from the family member or the nominated representative. So the whole legislation of Mental Health Act of 1987 is not only in line with the UNCRPD, it also is line with the Constitution of India. So that you need to understand. If some psychiatrist says that why should we have Mental Health Care Act? There is no Neurology Act, there is no Oncology Act, there is no Gynecology Act. Why should we have? Invariably, you are doing something against the Constitution of India. Like similarly, MTP Act is there. Why, sir, Medical Termination of Pregnancy Act should be there? Gynecologist also can rise. You are terminating, you are killing somebody, or you are aborting a fetus. That is against the right to life, Constitution 21, or Article 21. You are doing something against the Constitution. To protect you, as if you are a gynecologist and obstetrician, if you want to protect that there should be a procedural law, you need to fulfill those criteria. Then only you can do MTP. That means if you are doing anything against the legislation, or else you need to follow. If you are doing anything against the legislation, against the Constitution, you need to have a procedural law. And that procedural law should be fair and justice. So you need to understand this. If you don't understand this, you will be, as Dr. Harish, the HOD said, you'll be saying, why should we have Act? Why should we have Mental Health Care Act? These kind of feeling of betrayal by the psychiatry fraternity you will feel. But please understand, the Constitution of India gives right to you, me, a person with mental illness, and also a person who is being accused of crime. Let me tell you, imagine if somebody is accused of crime, stealing something. Now, for him, if he is accused, he has many rights. He has to be arrested. To arrest, you have to show arrest warrant. And if it is cognizable offense, no need of any arrest warrant. They can arrest him directly. But within 24 hours, you have to produce in front of the magistrate. The magistrate will decide whether to give bail or not. And he will be taken to the prison. And he will be examined by the medical officer, and he has all the rights. Imagine, for a person with mental illness, there is no warrant. There is no checks and balance. Just because one psychiatrist decides or two psychiatrists decides, you can arrest and put him whenever you want. That doesn't, the Constitution doesn't allow. Then you have to follow Mental Health Care Act. So that this legislation gives you power to hold somebody against his wish and will for treatment purpose. You can say, sir, this is treatment, or how can you say all those things? Of course, you are doing treatment. Many people may say, I don't want treatment from allopathy, I want from Ayurveda, I want homeopathy. You may be very sentimental telling that, no, sir, allopathy is only the great. But the patient believes, I want to get treatment from other system. The Constitution recognizes those system, and you have to be respectful for that. Sir, how can it be so possible? It's a scientific basis. It is just like religion. Let's be very clear. Like religion, you may say your religion is great. I may say my religion is great. But you can decide what you want to take. Similarly, the Constitution gives you the power. Under that, if you want to do something against, there should be a procedural law. That procedural law is Mental Health Care Act. Without this legislation, you cannot admit and treat a person against his wish and will. That means we will be treating only anxiety disorders. You will not be able to treat a psychotic disorder because this Constitution doesn't allow. But Mental Health Care Act allows. Now coming to the Chapter 3, Advanced Directive. What is this Advanced Directives? Advanced Directive is a living will. Basically, any person who is an adult can write a will telling that if I become mentally ill, how I should be treated and how I should not be treated. And this has to be registered. This is done on a piece of paper, but registered to be registered with the Mental Health Review Board. Once it is registered, it has to be made available online. So that is Advanced Directive. Any person can write this. This advanced directives will kick in only when the person loses capacity. Imagine if I have written an advanced directive. When I have a capacity, you will not look into advanced directive. You will listen to me. If I lose capacity, that is comprehension, weighing the risk, communication. If I lose that, then the psychiatrist or the treating doctor has to look into the advanced directive. That is how it is envisaged. So just because somebody has written advance directive, it will not kick in only when he is loses capacity, and in emergency situation under section 94 you need not look into advance directive emergency treatment time. So that is how it is done. Sir, if somebody has written I should not be treated in my life, if something you have written in the advance directive against the law, or it which it is not enable, the family members or the treating team can go to the mental health review board and say, please amend it. This advance directive is not in the best interest of the patient. So the mental health review board has all the power to squash this advance directives or amend these advance directives or uphold the advance directive. So this is how the advance directive will work. And at the same time, the advance directive, there is a way to nominate somebody. Nominate means the patient can nominate, or he need not be patient. Any normal person who is above the 18, he can say 1, 2, 3, 4 people will be my nominated representative. In the way of hierarchy, you can write 10 names, 15 names, but they should agree to be a nominated representative. If you become ill and you lose capacity, and if the advance directive does not addresses your needs, then the nominated representative, based upon the hierarchy, they will ask the first person, see, he is now ill, what should we do, and that NR will take the decision. So that is nominated representatives. Every adult uh, shall have the right to appoint a nominated representative, but that person should agree. It has to be written in the advance directive and has to be registered with the MHRB. And sir, if there is no, if the person has not written advance directives, so invariably the relatives is the first choice. Who is relatives? Invariably, the if it is unmarried, father and mother will become. If he is married, the spouse will become the relatives. If there are no spouses, the blood relatives will be there. Sir, there are no relatives at all. Caregivers will become the second point. Third one is a suitable person appointed by the MHRB. Imagine if he is a wandering mentally ill, no family members are there, then the director of the Department of Social Welfare will be designated as the NR, or he can nominate somebody. Sir, director is also not available. At that time, a NGO can be nominated as a NR. So, what is the roles and responsibility of NR? They will become the parent of this person with mental illness. They will, considering the person's history, background, on that basis, they will take a decision in the best interest of the patient for treatment. It may be consenting for research, consenting for treatment, giving consent for ECT, all those things, they will take decision. So, till now, I've discussed about advanced directives and nominated representatives. Chapter 5, this is enumeration of rights they have done. From 18 to 28, they have beautifully named 11 rights. Those rights are right to access mental health care. This is the first time the government said, I will provide mental health care. They have taken the responsibility on them. Then is right to community living. That means just because somebody has mental illness, you cannot put them in the rehabilitation center. Right to protection from cruel, inhuman, degrading treatment. This were seen in the old mental hospital. A person is brought to the mental hospital means shave his head, chain him, and give him a dress which looks like mentally ill, put shots, that kind of thing. So those kind of things are not allowed. Or putting him in a closed room is not allowed. Right to equality and non-discrimination, right to information, right to confidentiality, restriction on release of information in respect to mental illness, right to access for medical records, that is section 25. I'll be discussing if there are any question with regard to that. Right to personal contact and communication, right to legal aid, and right to make complaints and deficiencies. So these 11 important rights have been there. So, right to access for mental health care. What do you mean by access for mental health care? All types of services, inpatient, outpatient, rehabilitation should be made available at the district hospital. To some extent, medicine should be available at the community center also. Affordable cost, quality, and quantity. And if those treatments are not available, imagine in Thrissur there is no psychiatrist available, and no treatment is available, and the patient from Thrissur has to go to a neighboring district, maybe Ernakulam or Calicut, for treatment. Whatever the cost, the government has to pay. That means compensation also has been clearly written under this legislation. And free treatment has to be given for a person with who is having below poverty line or a destitute. and long-term care also has been included. Right to protection from cruel, inhuman, degrading treatment, safe and hygienic environment, adequate sanitary condition, and even recently, I think in 2021 or 19, we did a study of women with mental illness in government mental hospitals. Unfortunately, there were no sanitary napkins were given to women. The hygiene was very poor. Maybe even the security was inadequate, and invariably for privacy was not there. Many women with mental illness across the country raised objection about this, and we have published this. And again, this publication is for women and child development authority. WCD has published this. It is available online. If anybody is interested, I'll be able to share that publication on how a woman in a mental hospital has difficulties facing, including not getting undergarments, all those things, privacy, clothing, not to be forced to undertake any uh, various activities, adequate provisions for preparing to make them to be what is that, stay in the community. Those are the things. And even how the food is given, how the food personal hygiene is mattered in women, no compulsory head shaving. The patient should be allowed to wear their own clothes, and also to be protected from physical, verbal, emotional, and sexual abuse. Uh, if you ask me, many patients who come from prison, basically prisoner with mental illness who is brought to the hospitals, have come across, at least in few mental hospitals, the prisons are better than the mental hospital. That means the patient will say, please send me back to the prison. I don't want to be in this mental hospital. That is the condition of the mental hospital at this point of time. I'm not telling all the hospitals. Some of the hospital is in a very pathetic state, and they are worse than the prison. So that's the state currently. Right to equality and non-discrimination, this is basically equivalent to physical health, providing ambulance, insurance, which was a big issue because mental illness was an exclusionary clause. Attempted suicide was an exclusionary clause under the various health insurance. So this legislation started telling that you can't exclude person with mental illness, you have to provide care. But anyhow, still there are problems occurring with regard to insurance. It may be with regard to psychotherapy, it may be with regard to non developmental disorders like autism, SLD. They say it is by birth, we can't provide services. So there are some hiccups going on, and many a time they refuse to cover the health insurance. If somebody had written, this is again, I'm seeing in demands, a junior resident will write, this person had taken one glass of wine. That alcohol use will be exclusionary clause because that person has never written in his health insurance that I was taking alcohol. Just because he had used alcohol once, the health insurance will be cancelled. So we need to be very careful what we document regarding the insurance. Those are the things are being seen. And psychotherapy, the insurance is not covered. Many a time for the RTMS, some of them are accepting, some of them are not taking accepting. So the insurance is still a debatable issue, but by and large, it's slowly moving towards the positive side. Coming to the right to information, it's providing information, not the records. This is information is giving information to the patient or the patient party. This, you have to give information to the patient only. No, sir, patient doesn't have capacity. You will give the information to the patient's nominated representative. You will give information orally, reason for admission, a review of admission procedure, treatment procedure in the language what the patient or the patient family members understand. Don't give records. Right to confidentiality is very essential. You cannot just break the information. So there are exceptions have been given. Under what circumstances they have given nominated representatives, you can give. If he is dangerous to self and others, you can give. For continuity of care, imagine I'm referring a case to Dr. Harish in Kerala. I have to give a discharge summary, or I can write a letter to Dr. Harish and saying, sir, I am referring a person. Please continue the treatment purpose. Then the confidentiality can be broken. Right to access for medical records, Section 25. It says all persons with mental illness, not the family member. Only person with mental All persons with mental illness shall have right to access medical records. It's not everybody, only person with mental illness, not even the nominated representatives can have access to medical records. The wordings are very clear. All persons with mental illness. That means not the family member. So again, what should be given? Basic medical record, not all the record to be given. Basic medical records have been defined in the rules. Right to community living, right to legal aid is there, right to restriction of release of information, right to personal contact and communication, right to make complaints, all those things. The substantial law covers there. Now coming to appropriate duties of the appropriate government. What is appropriate government? It is state government. Kerala is a state government, and then that what is the duty of the state government? State government promotion of mental health and prevention program, creating awareness with regard to mental health, illness, and about this legislation. Appropriate government should make measure to regarding human resources development. That means we need to increase the number of psychiatrists, clinical psychologists, social workers, nurses. Coordinating with appropriate government is basically other departments. They need to work with them so to improve the mental health services. Now we will come to the, till now I spoke about the substantial law of the Mental Health Care Act. Now the implementing agencies. Who are those implementing agencies? Central Mental Health Authority, State Mental Health Authority, and Mental Health Review Board. So these are the statutory bodies. So what is the role of Central Mental Authority? Central Mental Authority will look into the central government agencies. What do you mean by NIMANS? Although NIMANS is in Karnataka, it will not be governed by State Mental Authority of Karnataka. It will be governed by the Central Mental Authority. All railway hospitals in Kerala comes under Central Mental Authority. All army, armed forces hospitals will come under Central Mental Authority. So it's basically who has control over that hospital. All private will come under State Mental Authority, because the state will be giving the legislation license or registration for them. So all private will come under the state. All central government controlling governments will come under the Central Mental Authority. So that you need to understand. So these mental health authorities will be governing those hospitals. So what is this Mental Health Review Board? Mental Health Review Board is a quasi judicial body. Judicial body means like district court. So whether NIMANS comes under Central Mental Authority, State Mental Authority, the review board is like a district court of the state. I have to go to there. Review board is a judicial independent body. That is a we can call it as a quasi judicial body. Quasi judicial means it's not completely a court, not a committee. It is a kind of, there is a judge and other four people are there. So this review board, every in that jurisdiction, imagine in Thrissur district, this whether it belongs to Central Mental Authority, whether it becomes State Mental Authority, whether it is a state government medical college or it is a armed forces from the central government, they have to report to the Mental Health Review Board. That means report means any questions of the rights violation, Mental Health Review Board will come in. How is it? It's like a judge of the or the district court there, district court of Thrissur. Any crime occurs, you will go give a complaint to the police and it will be taken to the court. So Mental Health Review Board is a judicial body. So it is the geographical jurisdiction for review board. Understand, review board is geographical jurisdiction. Central Mental Authority, State Mental Authority, it is the power exercised jurisdiction. Who is having the power more on that body or or the institution? So that is the power based. This is jurisdictional based review board. So these are the three important statutory bodies. Central Mental Authority is there. How the Central Mental Authority has to be established, who is going to be the chairperson, how often they have to sit, how much money has to be given to them, how the registration will be done, what is their roles and responsibilities. Those basically, that is the Central Mental Authority. It is more of the kind of advocacy, administration, telling that whether the Mental Health Care Act has to be amended or not, how the central government will be taken into consideration for amending the act or the rules. So that is roughly about the Central Mental Health Authority. Similarly, the State Mental Authority, the who will be the chairperson, who is the member secretary, all those things have been written in the State Mental Authority, and how they will be selected, and how often they have to sit for a meeting, what is their role, and how the registration of the each establishment is given. All those things are written in the statemental authority. And then comes the financial and audit. This is basically the money, whatever is there from the state mental authority or the central mental authority, how the finance is there, accounting, all those things are written there. Another is the mental health establishment. What is mental health establishment? It is nothing but anywhere a patient is admitted overnight for treatment purpose and rehabilitation purpose who has been kept. This is the simplest way of uh, defining mental health establishment, which is written under Mental Health Care Act of 2017, making it very simpler and concrete. That is, any person who has kept overnight for the purpose of admission and for the purpose of treatment and rehabilitation. So house will not come into picture. The group of patients who are staying together by their own do not come. They are considered as sheltered accommodation. Another one is supported accommodation, where the patient is staying alone. The treating team, nurse will go and meet him. That is support. So those will not come under the mental health establishment. What about the OPD, sir? I am running a OPD. OPD, the patient is not kept overnight in the hospital. So you do not come under as a mental health establishment. But any rights violation occurs, Mental Health Care Act will come into picture. You can't say, sir, I have not registered, I am not mental health establishment, I run only OPD, and you are beating up the patient in your OPD. Sorry, the legislation will come into picture. This clause, mental health establishment to register, exceptions have been given to OPD, daycare centers, supported and sheltered accommodation. If you are going to keep the patient, you have to register. OPDs and other have not has been exempted from registration if you violate any of the rights which have been enumerated wherever in the jurisdiction of India. This act will prevail. Whether to register or not register is the only exemption is given here. So about the mental health establishment. So that is about mental health establishment. And mental health review board, again I said mental health review board, who are the members, how it has to be done, and what are the roles and responsibilities, what is the power of this mental health review boards have been given. So that is basically quasi judicial body. It is a geographical jurisdiction. Now comes to important aspect, that is admission and treatment of person with mental illness. So there are various section 85 to 99 which discusses about the admission and discharge. Regarding admission, there is something called as independent admission, that is basically voluntary. That is old wine in a new bottle. That is voluntary admission was the earlier. Now it is independent admission. That is any person who has capacity, who wants to get admitted under section 86. As an adult you can admit. Sir, if he's a minor below 18 years. So section 87 will come into picture. Then the consent of the family member will be taken. The family members under 87, because he is a minor. Adult under 86, he has to give a requisition to the mental health establishment. There, either the psychiatrist plus one mental health professional can admit the person. Two people have to sign. Either the psychiatrist and a mental health professional. So that is about voluntary admission. And you need to inform the mental health review board regarding the admission. If it is women and children, you have to do it within 3 days. Now coming to involuntary admission or supported admission. Supported admission, there are two types. One is less than 30 days, another one is beyond 30 days. So if you want to keep somebody for admission against their wish and will, first admission has to be 89. You can't just admit somebody under 90. Because I see somebody looking very chronically mentally ill, I want to admit under 90. No. First you have to admit under 89, exhaust for 30 days. If it doesn't improve, then you will shift to 90. Please understand that. You can't admit anybody under 90 directly. First admission has to be 89. Once he has admitted under 89, how to admit again? The NR has to request, nominated representative or the family member has to request that my ward or a family member is suffering from mental illness and he has these problems. The doctor has to examine him or the psychiatrist to examine him to check whether he has capacity or not. If he doesn't have capacity and he has mental illness and he needs admission, then you are going to admit. Again, under 89, a psychiatrist and a mental health professional. Sir, after 30 days, he doesn't improve. Then you have to immediately make an application to the mental health review board telling that we have admitted under 89. For 30 days, he did not improve. He continues to have symptoms. He is unable to take care of himself. He continues to be violent. He continues to be dangerous to self and others. And then you have to request for continuity under 90, shifting to 90. So first that under 89, you shift him to 90. The first 90 under section 90, 90 days will be kept. If it doesn't improve, again you will ask for 120 days. If it doesn't improve, afterwards it is 180 days. That is every 6 months he will repeat, telling that he did not improve, and every time under 90, mental health review board has to give permission. Whereas 89, mental health review board, you are informing. Only information is given under 89. 90, you have to take permission from the MHRB. If they don't give permission, sir, no need to worry, continue the treatment. That has been covered under the regulations. So this is I have told about the voluntary admission, 86, 87, this is the procedure. Involuntary admission, 89, this is the procedure. To psychiatrist under 90, this is how you have to go. Emergency treatment, again, this is one of the biggest mistake our psychiatrists do. Section 94 talks about emergency treatment, not emergency admission. So in many of the private hospitals and government medical colleges, what they are doing is emergency admission, they are showing. It is not an admission, it is an emergency treatment. What is the difference? It is a nomenclature difference. I'll give examples of our own NIMANS. Earlier, we used to call it as emergency ward admission. That is 24 to 48 hours we used to keep. We used to either admit or discharge. But Mental Health Care Act doesn't give permission for emergency admission. It is emergency treatment. You have to remove the admission. You have to say he has been kept for emergency treatment purpose for the purpose over a period of 72 hours. There is no admission, there is no discharge here. It is you are kept for emergency treatment. Maximum is 72 hours. But in a hilly areas like northeastern place, maybe in Nagaland, Manipur, in a hilly area, it has been given extra duration. 120 hours they have been increased for the hilly terrain. But invariably across India, it is 72 hours. Why, sir, 72 hours? Basically, we again borrowed from UK. In UK, they don't work on Saturday, Sunday. If they don't work for Saturday, Sunday, 48 hours is gone. If the patient comes in the evening around 4:30, on Friday evening 4:30 they come. Now you need to admit him, but the psychiatrist is not there. Two psychiatrists is not there. So you have to, under emergency treatment, you can keep up to 72 hours. On Monday morning you can admit. So that is the basic funda. Otherwise, why sir 72 hours? Where it came from? It is basically we borrowed from UK. But what is this emergency treatment? It is not an admission. Here it is a treatment. Where to give? It can be in the hospital. You can do in the community. You can do in the house. Anywhere in India. Need not be in the hospital. It can be done in PHC. It can be done even on the roadside. You can give emergency treatment. So emergency treatment, dangerous to self and others, or preventing damage to the property and belonging to others. That is how they have defined emergency treatment. So you need not worry. Sir, can I send an ambulance? Yes. Under emergency treatment, you can send an ambulance to the patient house. You can give treatment there only, at home. And you can shift him to the hospital. And from there, 72 hours will start clicking. Either you can admit or discharge. Emergency treatment, no discharge. So prohibition and restriction. What is prohibition and restriction? They have clearly said certain procedures cannot be done. Don't give ECT without anesthesia. If you give and you get caught, don't call me because you have done some violation. You have to face the music. And if you want to do psychosurgery, you have to take the permission from the review board. Without review board permission, don't do any psychosurgery. If you do, again, it is a contravention of the law. It is only 3 years imprisonment and 5 lakh rupees punishment. That's the very simple thing. Restrain, again, restrain is if you are tying up a patient, then you have to document it and inform the family members. A sterilization procedure is not allowed here. Chaining the patient, solitary confinement is not done. ECT is prohibited, especially in minor. And also, ECT cannot be given as an emergency treatment. What does it mean, emergency treatment? You can admit and give. Once you admit under 89 or 86, you can give. For example, I'll tell you, if the patient comes to Nimans emergency, I can't just go and give him ECT. I have to admit him. After 30 minutes, you can give. That means I first finish the admission procedure. Say that I've admitted under 89, then only you can give. You can't just give ECT on emergency basis. That is they have said. But you need to admit and then you can give. What are the role of police and magistrate? This is another big headache, because many a time the police department may not be aware of this legislation. Section 100 talks about duty of the police officer. Whenever a patient who is wandering at large, and or the police believes that this person has mental illness and is risk to self and others, in such scenario the police can take this person under their custody and had to produce them in front of a public mental hospital, and the medical officer of that establishment will decide whether it will admit under 86 or 89, or else he doesn't have mental illness, and they may discharge him, or they may say there is no mental illness, will not admit him. So this is about 100. So again, if a wandering mentally ill is there, what to do? A FIR, a FIR of a missing person has to be done under section 100. That means if a person, a wandering mental ill, if you find in your area, and the police, if they take him under their custody, they have to make a FIR of a missing person, so that they have to trace their family members. But invariably, very few police stations are doing this. If you ask me, I don't know why they don't do, but invariably, over a period of time, they may comply with this. And section 101 says that if a person with mental illness is been mistreated in a area or neglected, then the police will take that person under section 101, produce him in front of the magistrate. Magistrate can give order for admission and treatment for maximum 10 days, not more than that. After 10 days, the doctor has to decide will he will go under 86 or 89 or discharge him. So section 101 is that one. Coming to again, section 102, it talks about admission to public establishment. That means government. It does not allow for private. Why, I don't know, private has been discriminated, but it says only private, only government, and it does not exceed more than 10 days. Finally, the punishment, section 107 to 108, for the, like many of my friends and colleagues in Kerala, they say, sir, I'm going for a rehabilitation center. I do only telemedicine. I don't go there, but once in a month I see them, but they have not taken registration. If you are caught, they may ask you to pay 5,000 rupees to 50,000 rupees. If you are working in a mental health establishment without registration, in spite of knowing, no, sir, I do only OPD basis, but you know that it is not registered, you are providing OPD services, whatever you do, and the patient is admitted there, you will be punished with 5,000 to 50,000. After some days, you continue to provide services, they will charge with 50,000 to 2 lakh rupees. But third, also, if you continue to do 2 lakhs to 5 lakh rupees, that is the small amount, need not worry. That is how the, mental health establishment without registration. If you are working in a there is a slight mistake. Section, working in a mental health establishment without registration is 25,000 rupees. So again, this case will not be dealt by the MHRB, the state mental authority will be done. What about mental health establishment without registration? If you are running an establishment without registration, that is the 5,000 to 50,000 first contravention, 50,000 to 2 lakhs, 2 lakhs to 5 lakhs. If you are given your name to any establishment that I am a psychiatrist, I will provide care, and they have not taken registration, then it will be 25,000. That means 25,000 for you, and the person who is running that establishment will get 5,000 to 50,000. That is how it goes. If you contravene the law, contravene means you do something against the legislation of Mental Health Care Act, 6 months imprisonment, and fine may or may not fine up to 10,000. If you continue to do contravention, it will be 2 years imprisonment will be there, and 50,000 to 5 lakh rupees. And finally, the section 115 talks about decriminalizing suicide. That is section 115. But however, Bharati Nyaya Samhita, which has come in newly, completely doesn't discuss about suicide at all. That means We are talking about decriminalizing under section 115. Bharati Nyaya Samhita has not discussed about suicide except in one place. It says if somebody threatens a public officer that I'm going to commit suicide, that is a punishable offense. What does it mean? Imagine one of the somebody goes to a district commissioner and says, if you don't allot me the bar and restaurant or maybe petrol pump for me, I will commit suicide. That kind of threatening you do, then the I forgot the section 112 or something is there. There they can be punished for threatening a government official. But if you want to threaten your girlfriend that if you don't marry, I will commit suicide, it will not be punishable offense under this legislation. So this is how the legislation has been given. Other responsibilities of other agencies are there. Prisoners with mental illness, prisoners with the custodial settings. So those are the things. I think now I will stop here. So any questions are there, I will be able to take questions. But however, critically, if last few words, this legislation is amazing, excellent, very good, phenomenal. But unfortunately, family members' roles have been made it to negligible because in UK, US, the role of family members are very poor. So they have not taken family into consideration. The same has been taken from there and implemented here. Unfortunately, we see many patients, family members are bringing them, and our psychiatrist will be saying, see, he has insight, he has capacity, he doesn't have insight, but he has capacity, I can't treat him against his wish and will. And they are sending those patients back. And what is the clinical answer? I don't know. What is the law? You are following the law. So that's the biggest problem. And family is a biggest asset in India. If you see, even in any mental hospital or any psychiatrist, it is the family member, either the mother or father, who will bring the patient. Many a time, sister or wife, they will bring the patient. And this legislation is going to break the family more. And what will happen in the long run? They will disown the patient, and the patient will be wandering mentally ill, or he will create a ruckus in the public, he will be arrested, and he will be in the prison. So invariably, the state do not take care of the persons with mental illness. It is the family who are providing the care, and this legislation completely ignores the family, especially in India. Even in Kerala, or maybe in Bihar, or maybe in Karnataka, Tamil Nadu, it is a family member. Wish this legislation had taken consideration of the family member is one of the major drawback. Otherwise, it is one of the best legislation in the world, considering the rights of the persons with mental illness. That means it has empowered the person with mental illness enormously and disabled the family members. That's what is my critique. And I will stop here. If any questions are there, I'll be happy to answer.